χαρούμενοι σήμερα που έχουμε την εξαιρετική τιμή και χαρά να έχουμε μαζί μας τον καθηγητή Aasim Padela. Ο καθηγητής Padela είναι πολύ γνωστός στον κόσμο για τη συμβολή του στα θέματα της θρησκείας και της ιατρικής όσον αφορά την θρησκεία την μουσουλμανική και την αντιμετώπιση των διαφόρων θεμάτων και την αντιμετώπιση της ιατρικής, της σύγχρονης από το Ισλάμ. Ο καθηγητής Padela είναι γιατρός, τελείωσε το Weill Cornell Medical College και έχει και ένα Master in Science in Healthcare Research από το University of Michigan. Τελείωσε την εκπαίδευσή του στην Επείγουσα Ιατρική στο Πανεπιστήμιο του Rochester. Έκανε ειδική εκπαίδευση στην ιατρική ηθική στο McLean Center for Clinical Medical Ethics στο Πανεπιστήμιο του Σικάγου και έχει μια εκτεταμένη εκπαίδευση στην θεολογία του Ισλάμ και στη νομική όσον αφορά τα θέματα αυτά. Είναι διεθνώς γνωστός, έχει γράψει πάνω από 120 ερευνητικά εργασίες που έχουν δημοσιευθεί σε peer review περιοδικά. Είναι συμμέτοχος σε πολλά βιβλία και συγγράμματα και πάρα πολλές φορές έχει παρουσιαστεί στα μέσα μαζικής ενημέρωσης όπως το CNN, το USA Today, το Chicago Tribune, Washington Post. Με άλλα λόγια, είναι ένας άνθρωπος ο οποίος έχει μελετήσει, ξέρει καλά ένα δύσκολο θέμα το οποίο θα μας αναπτύξει σήμερα, το οποίο έχει τον τίτλο Islam, Health and Muslim Healthcare, που όλοι καταλαβαίνετε σε τι πρόκειται να αναφερθεί. Dr. Padela, it's a great honor for us to have you here with us today. We are anxiously waiting to hear from you a difficult topic which has to do with Islam, health, and Muslim healthcare that very few people in the world know and can pass the right messages to both physicians and lay people and theologians. So we are very, very happy and eager to listen to your presentation. Thank you again.
Thank you. It's my pleasure to be amongst you this morning, or here morning and afternoon where you are at, perhaps. And I'm delighted to share with you some reflections on the topic of Muslim health, Islamic notions of health, healing, and illness. Let me just get my screen shared and we can begin. So let's see. There we go. So can you all see the screen correctly? I hope. Yes, hold on one second. I can't see you. Hold on. Let me make sure I can see you. All right. Very good. So this morning, I'm going to share with you this talk on health, healing, and illness. And as you've heard, I am at the Medical College of Wisconsin, but I also direct a nonprofit institute called the Initiative on Islam and Medicine. My work has to do with intersection of Islamic tradition, biomedicine, Muslim practices. Something's wrong with my screen here. Hold on. Oh, sorry, give me 1 minute here. My apologies for the technical difficulties.
Don't worry, everything is okay.
It was doubling my screen, so I couldn't quite see you all when I was presenting. So give me 1 second here. I'll fix it to the presenter view. All right, now we're all set. So as I was mentioning, that my work has to do with this intersection of the Islamic tradition, biomedicine, and Muslim practices. And I do work that's empirical, textual, and theological. So primarily, I think about how Islam animates the decisions that Muslim patients make and how it influences their healthcare behaviors. I think about how Islam informs the bioethical attitudes of Muslim physicians and their medical practice. And lastly, in a more sort of theological register, I think about how Islam informs the way in which Muslim scholars engage with medicine through the bioethical and moral guidance that they provide. So my interest is in this holistic understanding of how patients, clinicians, as well as religious scholars think about the field of biomedicine through the lens of Islam. So the first part of this talk is going to be a little bit around, intersections between religion and medicine. Then I'm going to talk a little bit about Islamic theology. I'm going to give you some scriptural notions of how health is constructed and conceived of, illness and healthcare. And hopefully at the end, we'll have a few minutes to talk a little bit about how this reflects onto Muslim patient healthcare. So the first question, usually when I speak and I chat with individuals who are theologians or studying religion, is I just ask them what they think religion is and how they study it. And unfortunately, given that we're in a virtual environment, I won't have that much time for interaction, but usually students come up with 3 different ways they think about studying religion. This first example here is from a social scientist, and they think about religion as a unified system of beliefs and practices that unite a moral community, right? So a social scientific lens of what religion provides. William James, who was a prominent psychologist, thought about religion as the feelings, acts, and experiences of individual men and women that stand in relation to whatever they may consider to be the divine. So religion here is then thought about as an individual, right, a relationship between, and an individual experiences between themselves and whatever they think to be the divine. And lastly, Paul Tillich, a prominent theologian, pointed out that religion, it points to that which is infinite, what's ultimate, and it's of ultimate concern. So if you think about these things, religion has social aspects, right? It has individual experiences, but it also brings together this notion of truth claims, right? It probes deeper truths, the ultimate reality. And so when I was at the University of Chicago at the Divinity School at an appointment, we would consider ourselves as the individuals who would teach the academic study of religion, which means we want to unite all these things, but look at particular dimensions of how religion is manifested in society. So for us, when we think about the engagement of religion and healthcare, I often tell my students to think about religion as a cultural system, right? That has many different dimensions. It certainly has a social scientific dimension, a communal dimension. And that leads us to think about the sources of study being communities, right? That the tradition is the religious tradition is manifested in lived experiences of communities. Or you can think about religion as having an axiology or moral code. And then you would think about studying those texts, if it's a scriptural tradition, or those leaders or religious standard bearers who would profess out what the theology of that religion might be. And if you're thinking about religion as a philosophical set of claims about reality, again, you would then go towards those textual texts that speak about those truth claims, or those standard bearers of the tradition who make those truth claims. So each dimension that you think about leads to a certain type of source of study, right? And that only makes sense when you put it all together. So at the intersection between religion and medicine and healthcare, I think it's now more clear than where we have been living in the last 2.5 years or so in the pandemic, where there's been concern about what religion is portrayed as, right? So here are some news periodicals from the United States, and how I want you to note how the discourse between religion and medicine, or religion and healthcare, is brought about. So this first one here talks about a church defying COVID-19 stay-at-home orders to continue to hold Sunday services. You saw this again, this is a different state, not Louisiana, but Texas, where pastors were demanding religious liberty exemptions to stay-at-home orders. These sorts of conversations led, right? So in Oregon, they judged statewide restrictions on congregation size, and they gave religious exemptions towards churches. And then you saw more recently, perhaps around the vaccine debates, right? That the religious rights hostility to science was crippling our response to be able to get individuals vaccinated or to stem the spread of disease. This just didn't occur in the United States. These sorts of same narratives are abroad as well. So for example, we had this very early on, right, in April 2020, where a prayer meeting, so to speak, in India was thought about as a super spreader event, right? And they found that this Tablighi Jamaat, a Muslim religious sort of organization, spread disease in 6 Indian states. You saw a South Korean church being, again, a site for transmission of disease, and they tracked that. You had in Africa ideas around how we can treat the disease. So there were news articles about Pentecostals and others waging a spiritual war against coronavirus using maybe folk and religious and worship-based healing methods to combat the disease. And then even in Europe, right, even in the Netherlands, the idea about a Bible Belt, which I did not know existed there, right, that people are defying restrictions and then spreading disease. So again, I want you to note that religion is always standing in this conversation apart from science or apart from what the health aims might be. Now, these sort of social narratives of religious communities and activities being a vector of COVID-19 spread, we as scientists can think about that and say, well, what is the actual, data behind these sorts of things, right? And I would ask, if we do so, particularly around super spreader events, is there something special about religious activities and the association with super spreader events, right? Why is this the only narrative that exists or the dominant narrative that's occurring? So here's one paper that looks at just that. And I want you to note, they kind of noted earlier on various super spreader events. Some obviously were religious, but some were not, right? So you had a leadership meeting of a high pharmaceutical company here, Biogen, and they didn't reveal the case, but that also spread 99 positive cases within 6 states in the United States. You had a bartender in Austria, right, that infected about 1,000 people from Austria, Iceland, Germany, Norway, Denmark, right? And so perhaps biologically or scientifically, or biomedically, there's nothing special about religious events. It was just the idea of events. Yet in the popular press, you would see religion portrayed or religious individuals portrayed as some sort of odd individuals who are continuing to do certain things while others were not. Right, so I already mentioned this. Now, as I said, more recently, the idea that religious groups and religiosity are obstacle to preventive health measures, particularly around vaccination, was troped around in many periodicals, both in the United States and abroad. And there were actually webinars around this, right? Trying to end exemptions for religious groups around vaccinations. Again, once you look at, this is a paper from the United States, look at the data behind that, right? Is there something special or unique about religious groups and their sort of hesitancy towards vaccinations? And this is a multivariate models here for those who can read these data. But you'll see here that as much as frequency of prayer, which is a religiosity metric, right, had a lower odds of accepting vaccines or being more likely to hesitate to get the vaccine, you can see that race played a greater role, right, maybe a 4-fold greater role, right? Or political party affiliation had a similar role, but a stronger role of less odds of getting vaccines. Yet those tropes were not put in the narrative. And I say that because I think that we live, particularly in a post-Enlightenment heritage where religion and science are often set at odds with each other, right? Where science is the domain of empiricism and religion becomes the domain of superstition, right? Where science is rational and rationality is being used, but religion is a domain where, belief, right? Something beyond rationality is used to make claims. And that science is universal. We can all understand it, right? But religion is particular, only applying to a certain group of individuals. And this heritage colors the way in which we think about religion in the public sphere, but also religion and religious values within the healthcare sphere. I want you to note here, since I'm speaking a little bit about Islam, that this is an interesting character of Muslims being spread apart or looking away from this discourse. So again, just to say that in a different way, that religion is seen as a beyond reason sort of framework, right? An epistemological framework where it's strained logic. It is thought about as an inaccessible or intangible sort of set of claims that are made about reality. So the ontological schema of religion are sort of somewhere out there, right? Not based on empirical knowledge, or they're based on complex meaning-making structures that might not apply to everybody. And then more significantly, as you move to healthcare, that religion attends to a soft dimension of health, right? Something that potentially could be ignored and largely is marginalized in healthcare. I would argue that when we think about the intersection of religion and health, that there are convergences and divergences. That religion and medical science both help inform understandings of health, illness, healing, and cure. I'm going to share with you in a few slides how Islam generates concepts around these entities. Religion and science both inform health and healthcare seeking behaviors. If you were to do empirical studies, there are determinants of health behaviors that are religious only. There are determinants of health behavior that are scientific, meaning that they're based on medical knowledge. And healthcare decisions are influenced by both domains as well. That they are both converged and that they address fundamental human queries. For example, they provide explanations about phenomena, why you feel a certain way, right, and what is happening to you. And more significantly, perhaps, that they answer the question of the human end. What happens to us, right, at the end of our lives? Yet, both involve differing epistemic and ontological frameworks, right? So one's body of knowledge might use empirical investigation using senses as a primary means of ascertaining reality, while the other may use scripture-based claims as well. One might think of the human being as simply a body, right? While the other might think about as a body and a soul, and that will help explain things such as consciousness, right? Is it supervenience upon biological mechanisms, or is there some spirit animating the activities which leads to life and consciousness? About this notion of health, before I launch into the Islamic sort of notions here, I want you to again think about conceptions and determinants of health, right? Which is the main sort of idea that we deal with when we're talking about healthcare. So the WHO defines health as a state of complete physical, mental, and social well-being, right? Not the absence of disease. So there's a positive construction of what health is. And you'll see here in this caricature, there's this little notion of a spirit as well. So they were thinking about a spirit, something beyond perhaps the empirical senses. And when you think about health status, when we think about the determinants of health, this is a common framework, the social determinants of health, you know, that socioeconomic factors influence 40% of one's health, right? Physical environment, another 10%. Health behaviors, the things that we do, influence 30% of one's health. And then healthcare, right? The big hospitals that we have and the doctors and the doctoring that we do, only about 20% of one's health status. So healthcare has a minority role in someone's health status, while socioeconomic factors have a majority role, right? We can debate whether it should be 40, 20, or, you know, those numbers are estimates, but nonetheless, that's what this gets at, right? And we use this all the time as healthcare researchers thinking about how to improve patients' health, right? It's not just what we do, but what happens outside of our hospital systems. Well, the question here would be, where's religion in all this, right? Religion is often an indirect or subsumed factor, and that leads to religious communities being overlooked in this conversation about how to improve health, oftentimes. But I would argue religion is a strong determinant of health. So this is another model here when we think about healthcare services research, where we think about individual level factors that influence health, psychosocial factors, right, an interpersonal realm and then a structural realm. I just want you to know that religion is involved, or a notion of religion is involved in all of these realms, right? From health status, being influenced by spiritual sort of spiritual activities or religious activities, to the interpersonal realm, where the identity of being a religious individual leads to, and particularly for Muslims, leads to certain types of biases and discrimination when it should impact their health. And then even back there in the structural realm, right? There's religious sort of worldviews that influence institutions that provide healthcare, right? So I just want to note that even in a model here, religion is there, right? But it's often not brought to the forefront, right? So as I mentioned already, in the United States, nearly almost 40% of healthcare is delivered by institutions that have a religious identity. And they sort of have a philosophy as well as an ethics behind what sorts of healthcare services they provide. And if you look at studies in healthcare, you'll notice this is one, looking at religious involvement in mortality. This is a meta-analysis of many, many studies, right, that shows that religion has a positive impact upon longevity. So with that sort of preamble, let me go into what you really asked me to speak about today, Islamic sort of notions of health and healthcare. So the first part of this is going to be theologies of health and healing. I'm going to highlight, and this is the take-home slide, the central role of the God-human relationship in that within a scriptural lens. And the second part is going to be about depictions of health and healing through stories of the prophets. And the notion here is that we need to have a proper comportment with God, both as a patient and as a healer. So that's how healthcare is constructed within an Islamic worldview. So here we go. So first, to begin with, thinking about life, right? And what is the Quran and the Sunnah? So the Quran being the textual, what we believe to be the words of God, and the Sunnah being the sayings, doings, actions, and tacit approvals of the Prophet Muhammad. Both of them coming together are thought of as revelation, right? In our tradition. So what does the Quran tell us about the purpose of life in this world? And here are some verses to ponder upon, reflect upon, right? That the first verse here is that God says, I have not created man and jinn except for worship, right? That is the ultimate goal, right? There's other traditions in the prophetic tradition talk about that I created the world sort of to know me, right? In that sort of way. Another verse in the Quran talks about worship. So now worship your Lord until there comes to you certainty. And the word certainty here is not reflects, and the commentators talk about this notion of death, that is the only certain thing that we know about. And then this idea, the third verse here I share with you, is that he is the one, meaning God is the one who created death and life in order to test which of you is best in deeds. So from these and other verses and traditions, we get this notion that life is of instrumental value, right? That the life is, that this life, meaning the worldly life, is a place of cultivation, right? Of deeds. It is to set a record, right, of merit for the afterlife. It's a merit-making sort of grant from God. That this life here is a temporary abode, and it's a place of tests and trials, right? Even the idea that death was created as a creation of God to test you, right? To see how good your actions are. So this picture might give us a sense of the analogy, right? Or the character of life. That life is a journey, right? That one takes with certain provisions, moving from one destination to another, right? That we begin, from an ontological realm, we begin, in the pre-eternal world, right? And then we move to this world here. This is temporary abode. Then we want to go to the eternal abode, right? With God. So our notion here is that this is just a journey, and that there are certain things that you bring on this journey to help you succeed in this life. One of those things, those grants for that toolkit, is health. So how is health constructed? Again, now I want to share with you some traditions of the Prophet Muhammad, peace and blessings upon him. So this is one, in Arabic, نِعْمَتَانِ مَغْبُونَ فِيهِمَا كَثِيرٌ مِنَ النَّاسِ الصِّحَّةُ وَالْفَرَاغُ, right? So that there are two blessings that I've highlighted or I've made red here, words that are important to know for those who know Arabic, to think about, right? Ni'matani, that they're blessings, right? And saha are the two words that I have made red, highlighted here. That's health. Saha is health. So that there are two blessings which many people sort of lose or don't ponder or give up: health and free time, right? That this is a blessing, that health is a blessing. This is another long tradition. إن أول ما يسأل عنه يوم القيامة يعني العبد من النعيم أن يقال له ألم نصح لك جسمك نريك من الماء البارد. So this is actually, I should start saying the Arabic since I'm speaking to an audience that perhaps might not know. But in any case, the English translation would be that one of the first things that's asked about on the Day of Judgment, from the favors, again, the blessings that God has given you, is that have I not, right? Alam nusahha laka jismak. Did I not, right? God is saying, give health to your body. You can translate in that sort of way, right? Did I not make your body healthy? Again, so now this tells us not only is a blessing, but there's a relationship between health and one's body. And this last tradition I want to share with you is that al-mu'min qawi, that the strong believer, khayrun habba ilallah, is more beloved and to God, or better and is more beloved to God than a mu'min al-da'if, a believer who is weak. And this tradition is sort of thought about that we should want to be healthy and sound and strong, because that allows us, human beings, to then do more merit making in this world, right? To do more good deeds and to bring about more positivity in this world. So that's why, but the hadith keeps on saying, that in both there is goodness, but one who is stronger can do more, right? So we should think about that as a goal. So these traditions tell us again that health is a grant from God, right? It's accounted for. You'll be asked on the day of judgment, did I not give health to your body? It's instrumental in value, and that it can be characteristic of the body, but is not reducible to such. By implication, then, healthcare, right, is a system, a social system that increases one's capacity for good works from a religious lens, right? Medical practice then becomes fard al-kifaya, which means a communal obligation, that there are individuals within the communities who are able to provide healthcare so that people's bodies are stronger, health is maintained and restored. And that healthcare seeking for individual Muslims becomes a permissible, and some might argue a recommended act, right? That you should be, meaning a recommended act, seeking healthcare to get your body stronger and keep your health up, or it's just simply a permitted act. And we'll talk about that in a few slides, a little more detail. So we talked about life and then health as an instrument, right, within life. Now let's talk about curing and healing. So again, some Quranic verses here. This verse is quoted, the Prophet Abraham is quoted saying, when I am ill, it is he who cures me. And then another prophet, Job, here, when he was afflicted, the Quran quotes him saying, that he says, Rabbi, anni masani al-dur wa anta arhamar rahimin. He cries out to his Lord, saying that affliction has befallen me, right? Look at the passive here, not saying, God, you've made me sick, or I'm whatever, but affliction has befallen me, but you are the most merciful of merciful. And this I said to you, the comportment is important. And for us in the Muslim tradition, all the prophets' comportments towards gods are a template, are exemplars for us to follow. So this sort of form of a prayer, that he is sick, but he's saying that, he's not asking to say for cure. He's noting that God is the most merciful of the merciful entities, so that noting that I have been fallen by some affliction, right, by some harm, but he doesn't say cure me, he just says that, but you're the most merciful, that I am going to bear what you've given me, because I know this comes from you and you're the most merciful of beings. The Prophet Muhammad also has statements about curing and healing, many, but I'll share with you some. So this first one is manzalallahu dan illa anzalahu shafa'an, that there's no disease that God has sent down, in the sense he's created, right? But he's also sent down or created a cure for it or healing for it. And there are many different narrations that have the same meaning. You'll see again here that in this tradition, he says that thou will seek treatment. So people ask him, can we seek medical treatment? He says, seek treatment in the command form, O slaves of Allah, for Allah does not create a disease, but he also creates a cure except for haram, right? So the words here, da and shifan, is the same as in the first narration. And then there is a tradition where he goes on a night journey, the Mi'raj, and he comes and he sees the inhabitants of hell and the inhabitants of heaven, and he also sees his nation at the end of time. And so he comes out, and then he sees this group, and he knows individuals who are going to go into heaven without any reckoning, and he says of them, right? It said of them that who are these people? They say, these are individuals who have not allowed themselves to be treated by cauterization. There's some other characters as well, but at the end, that these are individuals who put their trust in God alone. This is an important tradition because cautery, in other traditions from the Prophet and statements, we learn that cautery has healing within it, right? And so he's speaking about an available medical treatment or general medical treatment at a time, that individuals who forego that or abstain from that, right, have a high status, that they enter paradise without reckoning. So that leads to this notion about what is permissible, what is obligatory in terms of seeking healthcare. So now thinking more from an ontological register, how do we think about healing, right? So we have this notion within the Islamic tradition that God has certain attributes. We call the 99 attributes of God. He has more than those, but these are the ones that we have access to make us have a notion of relationship with God. So al-mumit and al-hayy, they are all living, and the one who brings about death, right? And so between this notion of he is the ever living and he's the one who brings about death, we have another sort of attribute, al-shafi, the healer. Ultimately, these traditions note, as I said, the God-centric notion, right, theocentric notion, that illness and cure and healing, these are all within the power of the dominion of God, right? And so we should recognize that, because that leads to an ethics and a comportment towards how we, myself and others as physicians, engage in the works of God, speaking of how we bring about healing, that it is ultimately in his domain, right? And that when we think about the Islamic bioethical system, or in this case, the legal system, we have to recognize that that is where things are coming from. So ontologically, then there's various realms of existence, right? That, and there are many different schema of this in the Islamic tradition. I'm just sharing one, right? That have a relationship to curing or healing, right? So if in this sort of, my teachers kind of helped us understand this, and we co-authored this paper. But if you think about, there's a realm of existence that's just the creator, and then there's levels of creation, including the realm of spirits, the realm of sort of non-physical forms and similitudes, and then there's the realm of bodies, the corporal bodies, which we are, right? That there's multiple realms here. Each one of them has a relationship to healing in this sort of way, that you bring about healing because God is the one who heals, through drawing his attention to your plight and using means that he puts healing within, right? And within our Islamic tradition, both in the Quran and the stories and the statements of the Prophet Muhammad and the stories of the prophets, we're given various ways to access that healing. So one, as I mentioned about this group of individuals who leave off Qadari, they're relying on God and trusting God only, right? And the prayer of Job that I shared with you was also this, some scholars say is related to that notion that he said, you're the most merciful. He didn't ask specifically, oh God, heal me. So you resign yourself to God and you trust in him that whatever he has bestowed upon you, whatever state you're in has benefit in it, is coming from the most merciful, and that draws his attention and can bring about healing. Right? A second level might be that you actually make supplication. You supplicate for healing to God, right? You raise your hands and ask him. That prayer is then carried by angels to God, right? And we're told to do this as well. And then that brings about healing. You can give charity. There's a statement from the Prophet Muhammad about, treat your ill, right? Mardakum, by sadaqah, by giving charity. So those good works that you do by giving charity, again, that is noted and recorded by the angels. And God, right, notices that, and his attention is drawn to give you healing by your act of charity, right, on behalf of your sick relatives. The prayer of others. So we're told to pray, to make prayer, and we do this oftentimes. If you go to a Friday sermon services at the mosque, you'll see that after every Friday prayer, there will be individuals say, "There's someone sick in our community. Let's make prayer for that individual." Let's make dua, supplicate for that individual. That again carried on to God, and that draws cure. You can have, and this is I wouldn't say controversial, but it's nuanced the way of thinking about it, that you can have glimpses of what to do through your dreams, right? True dreams, not all dreams, true dreams, right? Tell you how to take prevention for some malady that's going to occur. That could be a malady of disease that's coming. You can use medications and surgery, right? What we as healthcare doctors, right, wearing white coats provide, right, through the realm of corporeal treatments that God will put in that surgery or in that medication that we take, some healing, right? And this again, the Prophet tells us that thou would seek healing. Or you can have incantations, meaning the Quran itself, right? There are verses, and people use verses for healing, right? Or amulets, people write for healing, again, based on the drawing attention to your plight. And the Prophet Muhammad and other practices tell us about this, how to do this, and that brings about healing. My point here to show you is that in Islamic ontological schema, the realm of health, like, so you saw that we thought 20% of what doctors do, helps people in their health status. Here in the ontological schema from the Islamic tradition, just one realm has to do with what we are doing, right? There are many other ways in which to draw attention of God, to draw forth healing. And this is important for Muslims and taking care of Muslims, because they might use other modalities here. This is not complementary and alternate medicine the way that we think about it, or that we're taught about it, but really in a religious sense, right? There are other means towards healing, and we shouldn't belittle them, and might help us explain the attitudes individuals have toward these other means, right? There are multiple ways to bring about healing if God is the healer. I want to also note for a second that in our Islamic tradition, right, when we think about, everybody wants, and I often are asked to talk about Islamic bioethics, right, that it has to come together, the legal status of an action, like seeking healthcare, has to be consistent with the theological notions of how healthcare and health and healing is brought about. And then that leads to comportments of individuals, the patient and the healer. So I'm going to kind of now transition. I spoke a little bit about theology. Very early on, I spoke a little about law, that is a permitted practice. It's not obligatory. Now I'm going to move a little bit more to the adab, the virtues, right, of a patient and the healer, because they have that other aspect of Islamic bioethics within them. And I just want to now highlight for a minute this notion of what the legal status is in Islamic law around healing for two reasons. But first, let's just, again, the statements I shared with you, there was a prophetic directive to seek care, to da'u, but there's a reward for abstaining. We know there's certainty about cure, that God is the one who brings down illness and disease, and ultimately cure is in his dominion. Right? He is the healer. And that medicine, classical times and today, is probabilistic. So that means that healing, this act of seeking healthcare, is a permitted act that is raised to the level of obligation only in certain circumstances, meaning you're sinful for not seeking healthcare only in a minority and specific circumstances. And largely that has to do with, it's a life-saving treatment with certainty about a life-savingness of that treatment. Otherwise, it remains a permitted act. Again, it helps you understand how Muslims, right, may engage with the healthcare system. That classical notion has been expanded, right? This is not that recent, but it is recent from the perspective of the Islamic tradition, that not only is the treatment life-saving, but this juridical council said that it's obligatory, sinful, meaning if you don't seek healthcare, if it's going to cause a certain loss of an organ or a disability, or if the illness is contagious and a harm to others. And some scholars use this idea actually talking about vaccination in COVID-19. All right, again, now reflecting that into how we engage with Muslim patients, right? That this notion of fatalism that is given a negative connotation in the Islamic tradition would be more determinism, that we know that God is the one who cures and heals and brings about illness, so you should rely on God. It's an active idea, right? Not a passive one. And that refusing to seek treatment or refusal of treatments is a moral option for Muslims. So with that said, and before I sort of close and open up for a little bit of conversation, let's talk about the moral duties of the ill person, right? The comportment that the ill should have. So again, it's all about proper comportment with God, right? And so I want to share with you very briefly, it's a long tradition and statement and a story that happens, but there was a woman who was stricken with epilepsy. She asked the Prophet Muhammad, to make dua, to make supplication for healing. And he asked her what the situation is, what is her concern. And sort of says, well, I can make that supplication, right? But what is your concern? She says, well, but you'll have a higher station, right? In a sense, if I ask for something else, perhaps. So what's your issue? And she says, well, if you can make a supplication, I become uncovered, right? Meaning that I become disrobed, or my aura, my body is sort of uncovered when I have these fits. And can you help me? So he makes the supplication that she doesn't have those fits, that aspect happen, right? That she becomes uncovered. But if she maintains and bears with patience this malady, she will have a high reward. I'm not saying that's the ideal. I'm sort of saying that again, there's a notion that there's a comportment with God, right? So you can certainly ask for healing. You can certainly ask for what's the problem, if it's the pain of that malady, that pain be removed, but you have to have a relationship with what you're asking for and God, right? So again, back to God. We should stay within limits, right? So there's statements from the Prophet that you can seek treatment, right? But don't seek treatment. Well, that would be haram. You should not partake of impermissible substances, right? Or haram, unclean substances to cure. There's another tradition that says there is no cure in those sorts of substances. Now, there are several narrations where companions of the Prophet ask, can we make supplication? We can make supplication for healing, but what about death, right? And he says, no, you can't ask for death. You shouldn't be making supplication of death. But then what if we're in some trouble? So this happens several times. So he says, he gives this prayer to individuals, right? That if you are in a difficult situation, you shouldn't ask for death. You shouldn't request for death, but make this prayer, right? That, oh God, keep me alive as long as there's goodness and life for me, and bring death to me when there's goodness and death for me. And the highlighted here is that notion that that there is death in goodness. I mean, there's goodness in death. That for the Muslim tradition, death is not something to forestall and get away with. It actually is the meeting point, a transition to the better life that we hope. So it's not something that we think is an evil. Now, how does this relate to kind of now the doctor, right? The team, the patient care team. So, ethical, legal duties and moral conformity of the clinician. Well, as I mentioned to you, that one must recognize that they're a instrument of God, right? So again, this tradition that God, God has not sent down an illness, except for he sent down his healing. You should strive hard to deliver the best of care. So this tradition says, that God has written, has commanded ihsan, excellence on everything, right? In every circumstance. Why I say that this word ihsan in another narration tells us that ihsan, to live in that way of excellence, is to believe that God is seeing you. For if you don't see him, he certainly sees you. To always be in this idea that excellence is brought about by recognizing that you're being observed by God, and obviously then will be accounted for the things that you do. So that's also in medicine, that you should strive to deliver the best of care, recognizing this comportment of excellence. And that you should be giving comfort and hope to patients. So what's interesting about this narration here, right? So the Prophet Muhammad tells his companions that when one of you visits the ill, right, that you should reassure them, you should reassure them about their lifespan, meaning that God has written when they are going to die. He is in control, right? That won't change anything. Obviously, that's been fated, but that it will comfort the individual soul. Again, noting, right, give them hope that, look, whatever happens, I can help you, I can't help you. Whatever healing happens is all by leave of God. And even if we were to die, that has always been written, right? To give them a surety, not that, okay, that in a fatalistic way, but in a notion that, look, God is in control. So have your hopes and good expectations of God. And then there are limits, obviously, that physicians should take, just like patients. You shouldn't be engaging in the haram, right? But there's a tradition here that talks about individuals or physicians being held to a standard of practice, right? So this tradition says that if someone comes to you, right, that is not known and learned of medicine, but considers themselves to be, right, that person who's practicing medicine, he is responsible. I mean, you can't overstep the standards of practice. If you are learned in certain domains, shouldn't go in other domains, and kind of speak out of that boundary point. And then obviously here, there are many traditions that say that the life of a human being is sacred, right? So you shouldn't be taking life, right? So this helps us conversations around assisted dying and so on and so forth, that it is not within the purview of physicians or anybody to take life, that God has made sacred. So with that, I will sort of close. I believe we should still have some time for conversation around, this relationship between theology, Islamic sort of notions of health and healing, and then how that is reflected into patient care. This film here is an interesting one that brings it out in a particular way, and I encourage you to look at it. It was put together by Stanford Biomedical Ethics Program, where an individual, a Muslim patient, Afghani here, who develops cancer, he goes through his sort of questions around treatment, thinking about how that relates to his worship practices. And there are several places at which there is a cultural conflict because of lack of understanding and improper communication. So in any case, it kind of brings these things together. All right, with that, I hope I haven't confused you too much, and I'll open up the forum for some conversation.
Thank you so much. That was really a very, very interesting, very exciting discussion. We learned a lot, and at least personally, I realized how close the Christian religion and the Muslim religion, the Islam, is close. For example, you mentioned, "O son of Adam." I fell ill and you visited me not. And last week in our church, we had exactly the same passage with the same words, you know. And also something even more difficult, I noted here from your talk, there is goodness to death. And this is also something that the Orthodox Christianity talks about, you know, the passage to the eternal, the second life. So if this passage is death is good. Anyway, we thank you so much, Professor Padela, but please stay a bit longer. I have a couple of questions. The first question is, what are the 2 or 3 pressing issues you believe Muslim patients struggle with in terms of religious accommodation?
Yeah, so from my perspective, I've done some empirical work on this domain. And there are often things that come up within routine care, and then I would say there's things that come up in sort of exceptional sort of circumstances. So in sort of routine care, I think the dominant thing that people speak about and write about, and in my own research, is this relationship between the genders, right? So there is a strict notion around modesty, both for men and women, that is encouraged, and actually in the Islamic tradition, one of the statements from the Prophet is that every religion has an innate character. The innate character of religion is modesty. And that leads to sort of 3 domains, I think, of concern potentially in the healthcare system. One is around, you know, gowning and robing, so dress code, right? Those gowns may be seen as immodest. One is around touching, right? Interaction between members of the opposite sex, right? And that has relation to how we actually examine patients, right? Do we fully disrobe them? Do we try to cover one part or the other, right? And this sort of a little bit of conversation prior to, for example, if I were to palpate a patient's abdomen, right, I might have a little bit more conversation with a Muslim patient if they're concerned about a female patient than I might with another individual, just preparing them for that experience. And the other thing is sort of about conversation, right? So oftentimes you and I are taught that we should have privileged privacy, right, in conversations. But sometimes there's this notion of seclusion, meaning that if an unmarried male and unrelated male and woman are together, that, you know, you shouldn't be in a secluded space together. So how do you maintain privacy but not being in full seclusion? And is that just having a curtain so people can hear, right? If there's an issue there, that there's an escape route, there's a door there, but just trying to be a little bit more concerned, or having a chaperone in the room if necessary, being a little bit more concerned about perhaps patients might not want to be in full seclusion and be uncomfortable with that, with a provider of the opposite sex. Now, those notions play a role in some health states and not others, right? So in my own work on breast cancer screening, modesty wasn't a big issue necessarily. Once you sort of said to them, hey, we have mammography centers that have all female staff, right? Don't be worried about that. So it might be something that's perceived, but not a real issue, right? And in other states in the United States, we have, for example, Somali refugees in both in Maine and Minnesota. Hospitals have procured more modest gowns, so their back is not fully open, right? So they feel more comfortable. In some hospitals, they allow you to wear your own clothes, right? Longer sort of robes, so that you don't feel immodest when you're being admitted to the hospital. So there's small things that we can do. One is communication, but some small accommodations to prevent delayed healthcare seeking. So in my own research in Chicagoland, I found that with, I think, a survey of, this is in Michigan actually, survey of 9 mosques or so, 20% of men and women had noted that they delayed seeking healthcare because of an inability to find a same-sex provider. In Chicagoland, with just women, 240 women, 53% had delayed healthcare seeking, right? And so I think this does impact preventive health practices. I said there are 2 exceptional circumstances. I think end-of-life care is a really ripe one, where in end-of-life care, there's fact-value fusion here, right? So meaning that oftentimes physicians use terms such as suffering or life not worth living, right? And we're making judgments about the quality of individuals living. That is perhaps a value attribution upon a medical fact, and it leads to conflict between patients and families. That's not unique to the Muslims, I would say, as of person who deals with ethics counsel. It's unique to in a lot of traditions and individuals. And I think we have to be cautious about that. But it becomes very live for Muslims because of where they see the medical care profession moving, right? With palliative sedation, with assisted dying. And so this idea that there are lives not worth maintaining or living, and that's reflected in the way that healthcare is practiced, is a concern for Muslim patients. And I would say that because we don't have healthcare facilities that run out of a Muslim mindset in the West here, or have palliative care hospices that are, right? There are Christian ones, there are not Muslim ones. This becomes a bigger concern for them. So those are two areas, at least, that I think that are impacting Muslim values, Islamic values impact healthcare seeking behaviors and healthcare decisions for Muslims.
Thank you. Another more general question, but I agree with the person that put the question. What do you believe is the role of religiosity, identity in the practice of medicine?
Yeah, so this is an interesting question, given that we are in the seminar series and course around health and religion. To me, as I start out my preliminary commentary, I think that we should recognize that religion is a factor, it's a determinant of people's health, whether that's religious practices or religious values. Either as when we look at all those studies, I mentioned one study, one meta-analysis, we know that people who are connected to religious communities tend to live longer than those who are not. You could say that's just because of social, right, community. The benefits of being in a community, having individuals check in on you, right? Having better access to certain sorts of help when you're ill. Another notion might be because you have better coping mechanisms. That's what some others hypothesize, right? That you can deal with issues of calamities and trials because you have a belief in the ultimate afterlife, or that you believe that God's bringing this to you, right? So we know that. So I think we shouldn't dismiss that. Not that we're saying that people should be religious. We're just saying that don't dismiss that factor and determinant of people's health decisions, health behaviors. For clinicians, I think this is the other concern, right? That we're not, and I know in Europe there's a different notion, but at least in the United States, we're not all the same. We come into medicine with a certain sort of notion of maybe, Catholics come with social teaching, and I want to become a doctor to help people, right? And I want to live out the mission of Jesus, so to speak, right? Perhaps that's why they came into medicine. Muslims might say, hey, I want to be a provider because I know there's discrimination against Muslims, that they don't find individuals, or I want to be a community leader. That we shouldn't dismiss that our motivations and our, sometimes I hesitate to use the word calling, but the reason that we're in medicine is for a certain notion. So we're not blank slates, right? There are two, or at least two, moral agents within the encounter. So I'm not saying that we should, again, I think we should acknowledge that. I'm not saying that we should always accommodate whatever the patient's physician's values are, but acknowledging is sometimes problematic, right? We treat healthcare or medicine as some neutral, physicians as neutral actors, but there might not be. Lastly, I think we should try, when we think about integrative medicine, right, we should acknowledge that people will be, as I shared with you, might be using alternate complementary medicines based on faith healing. They might go to faith healers. So we should be acknowledging of that and not having this discourse where religion always stands apart and anti-science. I think that's just problematic in many ways, as I showed with you. But oftentimes that's the first thing that comes to mind, as opposed to an assist, it's treated as a barrier or a problem for healthcare. So that's how I would address that question.
I think, Professor Padela, with these last words of wisdom, we should conclude our discussion. Again, we are so grateful to be able to listen to you and listen to new ways of approaching medicine and religion via the Islam and the Muslim practice. And we are grateful to you, and hopefully we can have the opportunity to have you next year with us. Or you might even consider coming to Greece and talk to us, not through the internet, but live.
Very
Thank
good.
you so much. Have a nice day.
Thank you. You as well. Take care.
Thank you. Take care.
Bye-bye.
Bye-bye.